Ashley. Well, Aftershock is a documentary released this past summer that highlights maternal mortality in black women. Now, Hartford Healthcare is committed to addressing these maternal health disparities, ensuring that every woman, no matter their race, feels safe and nurtured during their pregnancy. Take a look at a clip.
My daughter's story is loud, colorful, and artful. She was awake, aware, and active. And yet she still died.
Black women are 4 times more likely to die than their white counterparts with the same symptoms. Why is that?
This is a growing epidemic.
Now, tomorrow night, Aftershock will be screened as a method of internal training for Hartford Healthcare colleagues. And joining us now to tell us more is Daileann Hemmings, the Director of Maternal Health Equity at Hartford Healthcare. Daileann, welcome.
Thank you.
This looks amazing. Tell us about the viewing of Aftershock. How are you using this movie to train your staff?
Well, Aftershock is a movie that talks about the tragic death of 2 women that had situations that could have been prevented if it was caught early. So part of what we're using tomorrow to do is have a facilitated conversation so that in a safe space we can talk a bit about the issues that we see. Hartford has been doing some great work to try to help with that, but we're going to talk a little bit more about how we can address those issues.
All right, tell us more about how this will help in your training.
Well, we are asking for those who come to be able to be open-minded, right, and be in this space where they can learn about some of these issues that we're facing and be aware. That's a big thing, is to raise awareness about the issues for maternal mortality and morbidity, particularly amongst those of our Black individuals.
Explain, how big of a problem is this that you're seeing?
This is a national problem. There are about 800 women or 800 birthing people who die every year, and about 3 to 4 times women of color or individuals of color are likely to die. So it's important that we recognize not only that these deaths are happening, but that 80% of them could have been prevented. So how can we help in ensuring that this does not happen?
That's eye-opening. So many preventable deaths. All right, when it comes to health equity, this is something that you're committed to and have previously conducted implicit bias training. Tell us about that.
Yes, Hartford Hospital underwent implicit bias training that the March of Dimes actually helped with providing, and that happened for everyone throughout women's health, and also the leaders of women's health had additional training. And so this viewing is to help in reinforcing some of the information that was taught during that training and help for people to be able to have a discussion and assemble somewhat of a plan as to how we can address it moving forward.
All right, so you're showing this movie, you're training your staff. What is next for maternal health?
Well, there are a number of things that are in place now, such as our Patient Family Advisory Council that brings patients in so we can hear their voices. The Maternal Safety and Quality Program is in place. So next, what we're hoping to do is to be able to have a community viewing of this film, and we hope to do that in the spring.
All right, well, keep us posted. Daileann Hemmings, Director of Maternal Health Equity with Hartford Healthcare. Thank you for joining us today.
Thank you for having me.